There?
Yes, Tim, we're recording.
Okay, let me merge the call. Okay, very good. Senator, thank you for being patient with me, and thanks for calling me this morning. I wanted to ask you, the House right now, of course, is debating this stimulus bill, which the Senate approved, and the House is expected to approve it. How will it help Ohioans the most, do you think? Senator, are you still there?
Sorry, Tim, I got you.
Oh, I'm sorry.
Very good.
How do you think this stimulus bill will help Ohioans the most, with the anticipation the House will approve it today?
The most important part of this legislation is what it's doing for our healthcare system. Until we solve the healthcare crisis, we're not going to be able to get back to work and get the economy moving again. So it's a rescue package. It has provisions that help small business owners keep their doors open. I just got off a call with the small business community in Ohio, and they believe this is going to help them a lot because they can get a loan that converts into a grant. The loan is forgiven if you use it for payroll, as an example, or rent or mortgage or utilities. It's also helpful for those who have lost their job through no fault of their own, because they're going to now have a landing place, which is an enhanced unemployment insurance system, so that they can be able to make ends meet. And then finally, it's also very helpful to the economy at large, because it has a number of provisions that helps try to stimulate the economy through some tax relief. For instance, saying that you don't have to pay payroll taxes if you're a company of any size over the 2020 year, in order to invest more money in your business to be able to stay viable. So there's a lot in here that helps the economy. But ultimately, the most important thing is money for our hospitals, $150 billion, money to have more personal protective gear for our hospital workers and our other healthcare workers, money to get us more quickly to an antiviral medication, some sort of therapy where if you get this virus, you have the ability to take something to reduce the severity of it. And of course, funding to get a vaccine as quickly as possible. But that's not going to be quick. That's going to take a little while. In the meantime, we've got to be sure our healthcare system is prepared. The testing that's going on right now in Ohio is improving, but it's still not where it ought to be. So there's also funding in here to get more tests. I think that's really important for two reasons. One, by having more tests, we'll know better what's happening out there and be able to be more comfortable to reopen the economy as the test results start to come in and show some improvement. But second, when you're testing, you're also able then to trace where that person has been if the person tests is positive, to be able to find who else might have been exposed to that person and get that person into a self-quarantine. So it's important for the testing to give us some metrics, some data, some information to know when we can turn the lights back on, but also it's important to be able to stop the spread of this virus.
And Senator, we've learned that British Prime Minister Boris Johnson tested positive coronavirus. Your colleague Rand Paul has as well. How concerned are you for your own health and safety and those of your fellow members of the Senate and the House?
Well, as you know, I have legislation that I'm trying to get passed, which would enable us to vote remotely. And I think that's important during a crisis like this. It should only be used in very rare circumstances. But in this case, I think it's important that we not be in close proximity to one another and get through this like everybody else around the country is doing. So I know that the Senate has already voted on this legislation, and that's good. But who knows, in a few weeks, we may have to vote on something else to fine-tune it or to provide some additional assistance somewhere. I think it probably would be smart if we could do that remotely, securely, safely, and I think that can be done. So I'm promoting that. It's not something that, I wish were necessary, but I believe it is.
And Senator, are you home now? Are you kind of doing the stay at home? Or are you still in Washington and staying away from crowds in the public?
Well, I'm giving blood this afternoon, as an example. I drove myself home last night after the legislation was passed yesterday. And, it was a long drive, but I didn't feel comfortable taking an airplane and risking infecting anybody else. And so the key now is that all of us continue to practice social distancing. It's working in Northwest Ohio. It's working around the state. We've been fortunate in Ohio relative to some other states. Look what's happening in New York or Louisiana as an example. And I think one reason is we took actions earlier. And frankly, we took some tough decisions to close down bars and restaurants, theaters, bowling alleys, and so on. And I think it's important that we continue to do that. But again, Tim, that we have the information coming from the testing to know when we've actually turned the corner, when it started to get better. And that's when people will feel comfortable sending their kids back to school and going back to work.
And Senator, we know President Trump has talked about getting America reopened, maybe by around Easter. Health leaders have kind of balked at that. Is it too early to talk about lifting some of these stay-at-home type advisories or warnings for the public?
Well, all of us want to get back to normalcy, and our economy needs it badly. We're in tough shape right now. A lot of people unemployed, a lot of businesses shutting down. But we've got to let the science guide us. And this is why I think more tests is the key issue, because if you have more testing and you have a daily report on where we are in terms of new cases, and that starts to go down, which I believe will happen because of the measures we're taking, that's when people will feel comfortable to go back to work. That's when parents will say, okay, I'm going to send my kid back to school now. I just don't think it's going to happen until we have that information. And that's got to be led by the science, by the healthcare professionals telling us things are getting better, time to go back to work. There may be an ability, Tim, to do this on a regional basis because there's some regions of the country that are less affected than others. We also, I think, have to continue to give special attention to those who are most vulnerable. And that tends to be people who are over 60 and who have some sort of a medical condition in addition to the virus, should they get it. Those are the people who are most vulnerable. And so even when we reopen, I think we've got to think about how do you protect those people until we're through this thing.
All right, Senator. Well, I really appreciate your thoughts and your words there. Stay safe yourself. And
thanks, Tim.
It may take a little time, but we'll get through it.
Yep. Always good to talk to you.
Take care, sir.
Take care.
You so much.